Hey, this is Katherine Pannel. I'm a psychiatrist in North Mississippi and board member for Mississippi State Medical Association. This is our last part, our fourth part of the series about mental health in the pandemic. And I did specifically reserve this last module for healthcare workers because there's a lot of overlap between healthcare workers and obviously adult stress. But in addition to having just regular normal adult stress, we also have different stressors as a healthcare worker that just make those even worse and make anxiety, depression even worse. So we're already worried about family members and their health, our parents, the high risk population, our children. We don't want them to catch COVID. We worry about them catching COVID. We want to make sure that they're well taken care of. But being a healthcare worker, you're often exposed to COVID, or that you have an increased risk of potentially being exposed. So when you get to go home, it's not always that you get to go home and interact with your family. If you think that you're at high risk of exposure, you have to kind of self quarantine from your family, which can be so depressing and isolating. Our biggest support system usually is our family back home, and if you have to self quarantine to protect them, you don't get to be around them and you don't get to have that support. I have a good anesthesiologist friend who is, she's high risk for exposure because she's seeing possible COVID patients in the ER through intubation on the floors via intubation. And so when she returns home, she's in a separate part of her house, completely quarantined from the family. And it's been very hard on her. I mean, I get this. I think we all can get how isolating and depressing that would be. So we have those worries about potentially exposing our families and the need to quarantine, which can be very difficult. But in addition to just, financial worries for yourself and your family, I know salaries have been cut. Those that are working off production, they're not producing as much, so their salary isn't as much. But then some healthcare workers, some physicians have private practices. So they're not only worried about their business and their family, but now they're responsible for their employees' financial stability and protecting them and so that they can support their families. So with these decrease in reimbursements and lack of patients coming in, sorry, that's my cat, he normally sits in my lap when I do videos. So patient numbers are down, reimbursements down, and we are doing everything that we can do not to have to furlough or terminate people. I know we've had to be really creative, especially, in my clinic, we've tried to figure out ways to cut things so that it doesn't affect any of the employees. And we've been blessed so far that we haven't had to terminate or furlough. And I hope that'll continue to be the case, but that is a constant worry on my mind. I don't want anyone, I don't want to be, have anyone else be burdened by the financial strain of it or to lose their job. I mean, I'll do anything to, keep things going so that they can continue to work and receive income. So financially, we're worried. We're worried about the health of our family. Then we also are taking care of patients, and we're responsible for them, and we want to see them do well, whether it be mental health, internal medicine, ER. We are taking care of the lives of other people, and that in itself is an enormous amount of stress. We don't take that lightly. We as physicians are proudly responsible for these patients. We wouldn't have it any other way, but it is stressful. I know a lot of us take it home at night, having to deal with this COVID population, which is just, as with the whole pandemic, ever changing. These patients can come in seemingly fine and within hours be intubated, and it's very scary and very stressful. I have a friend who's also an ER physician in New York, and she's in one of the hot zones, and she's constantly anxious and worried. She said that she feels like she's on the edge of a panic attack. So increased anxiety, increased depression, what can we do about it? This is where, even though adults and healthcare workers have a lot of the same things going on, maybe for different reasons, but we still have that financial stress, the worry of the COVID stress. We can't always do the same things as the general population to deal with it. I know a lot of people are able to go home to their spouses, talk to their friends, talk to their parents about their worries and concerns. But people that are in the healthcare field are seeing COVID, they're seeing the really bad things, and taking it home to their spouses or friends is probably not the best idea. You don't want to get into the specifics with them because, gosh, you don't want to tell them the really bad stuff and increase their anxiety, stress, and worry too. That may be something that they're not equipped to handle. Please, share with your family when you're not doing well, or you're anxious or you're depressed, so that they can watch you and kind of monitor you and know they know your baseline, so they know when you're getting worse, and they can be our best judges to know when we need to get help. So let them know you are struggling for sure. Just maybe don't tell them some of the details and specifics of the exact things that you're seeing. So you're probably thinking, okay, well, if we can't talk to our family, then who can we talk to? I will say that there have been, throughout this whole thing, some really great things that have been put into place so that physicians and healthcare workers can seek help and seek help confidentially. I know a really cool thing that is being offered right now is a national physician hotline. It's specific to physicians, but it's staffed with volunteer psychiatrists 24/7, 7 days a week, where you can call and you can talk about your stress and worry. That number is 1-888-409-0141. And like I said, they're available to you and they can help you work through some things. Also, telemedicine, telepsychiatry is still going on. If you're worried about going into clinic, it's still, and not wanting to expose maybe a therapist, or if you two don't want to, you fear that you'll be exposed in office, we're still doing telemedicine, still doing telepsychiatry, and therapy is great. I can't stress enough how wonderful therapy is. I wish that it was something that almost like a yearly wellness exam, that insurance has required you to have like a yearly therapy examination, because it's just so wonderful to be able to decompress, to be able to talk about things, to formulate great ideas, plans to make life better. I think therapy is just great for everybody. So you do have that option as well. If you are one of those positions that's been terminated, or you are an employed healthcare worker and you don't have the insurance and you can't self-pay at this point, there have been some really great apps that have been established through time, fairly new, but have been around long enough to kind of work out the kinks. And the ones that I think are obviously the best, number one is Headspace. It's just a great way to sit, meditate, really decompress. You can do it on your iPhone. And if you are a member of the AMA, you actually get 2 years free subscription to be a member of Headspace. So that one's great. Then there's another one called Mind Shift, which is also great. It helps with those negative thoughts, that stressors, and kind of helps you obviously shift into a better perspective, and helps you cope with those things overall. There's also SAM, that is like a mindfulness app. It's good for depression and anxiety as well. And then there's Talkspace, which is essentially like therapy through that app. Those are all very easy to download. They're accessible like 24/7. We always have our phone on them, so they're phone on us. So it's always just easy to grab your phone and get going. So, and those are the other apps. So those are great options that you can go and, deal with the issues that you're having without having to really go into depth with your family. But like I said, don't keep your trouble from your family. Let them know how you're feeling. Just don't get into specifics, because they too are probably feeling anxious and scared, and telling them COVID stories is probably not going to help them either. So those are some ways to do it without having to necessarily rely on spouse or family. Also, I know as physicians, we get a great amount of support from hearing things that others are going through, that they're similar to us, that we're going through the same issues. It helps to feel like someone gets what you're going through and can get what you're talking about. So physician support groups are huge. I know we have one in Mississippi, Physicians for Mississippians, which is on Facebook. It is specifically for physicians. And we get to go and just kind of vent. And it's really great. Not only do you vent, but these physicians get to come in and kind of troubleshoot with you and help you work through their issues. But we also have a physician support group through that group that you can sign up for and get therapy, group therapy with other physicians. So there really is a plethora of things for healthcare workers. I know some hospitals are even reserving conference rooms to have places for healthcare workers to go and kind of decompress. I will say that hospitals are aware of the stress, they're aware of the issues, and they have really been supportive for the most part in making sure that everyone is attending to their mental health. So that's all I've got. Thank you for sticking with me through all 4 parts of this series. I'm sad that it's ending. I love to take the opportunity to speak about mental health whenever I get the chance. So thank you to Kim Methis for extending this opportunity. In one of my clinics, pretty much every day of the week, if you need appointments or if I need to help set you up with therapy, whatever I can do to help. But just keep on talking about mental health, because the more we talk about it, the more the stigma falls and the easier it is to get really good quality mental health care. Thank you.